You might have baking soda in your kitchen right now, but what hardly anyone knows is that this substance can either help you or poison you. Yes, you read that right. Depending on how and when you use it, bicarbonate can relieve symptoms or completely destroy your digestion, leading to deficiencies, infections, and even kidney problems. What's worse, many people use it wrong and think it's good for them. I'm Dr. John Whitaker. At my clinic, I've personally helped 3,217 seniors restore digestion and intestinal balance using safe, practical, and proven strategies that work in real life. If this already sounds important to you, click the like button. It helps more people find out this kind of information and tells YouTube that health after 60 is still important. Let me show you exactly when baking soda helps and when it silently harms. Chapter 1. Baking soda. What it is and how the body uses it. You might think that bicarbonate of soda is just a baking powder, but what few people realize is that your body makes it too, every day. Yes, the pancreas itself produces sodium bicarbonate naturally, and it does this for a crucial reason: to neutralize the acidity of the stomach as soon as the food enters the small intestine. It works more or less like this. You eat, the stomach releases strong acid to digest. When this acidic mixture goes into the intestine, the pancreas kicks in and releases bicarbonate to protect the tissues and activate the digestive enzymes. Now imagine what happens when this system fails. The acid reaches the intestine, but the pancreas doesn't respond as it should. That's when symptoms begin that seem commonplace, but indicate a dangerous imbalance: bloating, intense gas, diarrhea, constipation. It's not just discomfort. It's your body saying, something here isn't working as it should. And knowing this changes everything, because before you use any substance on your own, you need to understand what your own body is already trying to do for you. Chapter 2. Acidity and alkalinity, the vital balance of digestion. Imagine your digestive system as a highly coordinated production line. Each stage has a specific role, and if one of them fails, everything else starts to go wrong. It all starts in the stomach, and there the environment needs to be extremely acidic. Something between pH 1 and 3, practically like a battery. It is in this acidity that proteins begin to break down, nutrients are released, and invading microorganisms are eliminated. But this acidity cannot travel through the intestine. As soon as the food leaves the stomach, the body makes a switch. The pancreas kicks in, releases natural bicarbonate, and transforms the environment into something alkaline. Why? Because pancreatic enzymes, which digest fat, sugar, and protein, only work in an alkaline environment. Without it, they simply fail. Now comes the problem. When you take bicarbonate without needing it, or use it for too long, you interrupt this natural cycle. The stomach loses its acidity, digestion doesn't start properly, and everything that should be absorbed passes straight through. Worse, you lose your natural defense against germs that come from food, and the result accumulates little by little, in the form of vitamin deficiencies, bloating, poor digestion, and even immunity problems. The body knows what to do. But when we interfere unknowingly, the balance is broken. Chapter 3. When bicarbonate worsens digestion and doesn't help. This is one of the biggest mistakes I see in the office. The person feels a heavy stomach, that bloating after meals, and rushes to take bicarbonate thinking it's too much acidity. But what almost nobody knows is that it's actually a lack of acidity. That's right. When food stops in the stomach, when it doesn't seem to go down, what's missing is acid, not leftovers. And here comes the mistake. By taking bicarbonate, you only make this blockage even worse. Digestion slows down, nutrients stop being absorbed, and the symptoms intensify over time. In this situation, what really helps is the opposite. You need to reactivate acidity. And that's where simple strategies come in, such as a spoonful of apple cider vinegar before meals, or the controlled use of betaine HCl, which is like giving the stomach the strength it has lost. Now pay attention to one important point. Even those who use bicarbonate with good intentions, if they use it frequently, they start to weaken the whole digestive process. Protein absorption drops. Vitamin B12, iron, magnesium, everything starts to run out. And the immune system, which depends on acidity to neutralize microorganisms in food, also begins to fail. In other words, What seemed like quick relief can turn into a cycle of deficiencies and fragility. Chapter 4. When bicarbonate can help, with care. Not every use of bicarbonate is a mistake. In some situations, it can be exactly what your body needs, as long as it's used in the right way and for a limited time. A common example? That sharp burning sensation that goes up your chest, acid reflux, or the sharp pain of gastritis when your stomach feels like it's on fire. In these cases, a small dose of bicarbonate can bring quick relief. It acts like a fire extinguisher, putting out the fire momentarily. But that's all it is. Temporary relief, not a long-term solution. If the problem is gastritis, then bicarbonate can be part of the treatment, along with a nutrient called zinc carnosine, which helps to rebuild the stomach mucosa and treat the real cause. Another useful use is for those who are fasting for a long time, or who follow a more carnivorous diet. Some people in these cases feel their acidity rise at night, especially when they go to bed. At these times, a small dose of bicarbonate can relieve this discomfort, helping the body to rest better. It also has a curious, but very effective use in the mouth. Bicarbonate can help neutralize the acids produced by bacteria, preventing plaque, tartar, and even bad breath. It's even one of the best natural ingredients for homemade toothpaste. But beware, none of these uses replace caring for the cause. Bicarbonate can be a momentary support, never a daily habit. Chapter 5. Risks of chronic use of bicarbonate. This is where many people stumble, because if something relieves, the natural impulse is to use it more often, every day, as if it were something harmless. But the body doesn't work like that. Anything that offers immediate relief, if used without discretion, takes its toll. And in the case of bicarbonate, that toll is silent. When you constantly neutralize the acidity in your stomach, you are weakening the basis of your digestion. Without sufficient acidity, proteins are not broken down. Vitamin B12 is no longer absorbed. Minerals such as iron, calcium, and magnesium pass right through without entering the cells. And this doesn't happen overnight. But after a few weeks or months, you start to feel it. Unexplained tiredness, weaker nails, fluctuating memory, a constant feeling of stuffiness, and more frequent digestive infections. There's also another important point that many people overlook. Even though bicarbonate doesn't permanently alkalize the blood, it alters the balance of electrolytes, and electrolytes control your muscles, your heart rate, and your hydration. When this balance is disrupted, cramps, palpitations, and muscle weakness start to appear. And nobody suspects that the culprit is that little white powder taken just to relieve it. So the risk is not in the bicarbonate itself. It's the continuous, automatic, unnecessary use. Relief is good. But understanding why you need relief, that changes everything. Chapter 6. Therapeutic uses of bicarbonate beyond the stomach. Bicarbonate is simple, cheap, and found in almost every home. But its effects go far beyond digestion. For example, in patients with kidney problems, I've seen bicarbonate make a real difference. When the kidneys lose their ability to filter acids, the body starts to accumulate waste. And one of the most annoying symptoms is intense itching of the skin. A small dose of bicarbonate can neutralize this excess acidity in the blood and bring relief. What's more, in some cases it even helps to postpone the need for dialysis. It's not a cure, but it is a valuable support for the body, especially when accompanied by a dietary plan that respects this fragility. Another interesting use is for those suffering from gout or kidney stones. Uric acid, which causes these painful crises, dissolves more easily in an alkaline environment. Bicarbonate helps to create this environment, allowing the body to eliminate the excess more efficiently. In cases of urinary infection, it can also temporarily change the pH of the urine, making it more difficult for certain bacteria to survive. But beware, this does not replace antibiotics when they are needed. It's just a complementary strategy in the early stages or to reduce recurrences. Now, a very different but surprising use is in the world of sport. Some athletes take bicarbonate before races or intense workouts to slow down the buildup of lactic acid in their muscles. This allows them to do more repetitions, maintain their performance for longer, and reduce fatigue. And if you think that's it, bicarbonate can also be a natural ally against pests in the home. Combined with sugar, it attracts cockroaches And inside these insects' bodies, the chemical reaction of bicarbonate generates gases that they can't get rid of. It's a simple and safe way of dealing with the problem without spreading poisons around the house. But as always, the secret is in the context. Using bicarbonate with awareness can offer real support to the body. Using it automatically, on impulse, that's where the risk lies. Chapter 7. Practical Precautions and Common Mistakes in Use. Bicarbonate can help, it can relieve, but it can also get in the way, a lot, if used in the wrong way. One of the most common and most dangerous combinations is with vinegar or lemon. Many people mix them together thinking they're creating a natural tonic. What they're actually creating is a chemical reaction that releases carbon dioxide in large quantities. The result? Bloating, excessive gas, and even abdominal pain, especially in those who already have digestive sensitivities. Another common mistake involves insect bites. Yes, bicarbonate can help relieve the burning and itching, but only if the venom in the sting is acidic, as is the case with ants and bees. If the sting is from wasps or spiders, which have alkaline venom, bicarbonate will only make the reaction worse. In these cases, it's best to apply something acidic, such as vinegar. And if it's a spider bite or even a snake bite, the precautions are even more specific. Use activated charcoal, bentonite clay, or even milk thistle, which help the body eliminate toxins more efficiently. Now, there are simple and safe uses that are worth remembering. A small spoonful of bicarbonate inside the fridge helps to eliminate odors naturally, and when mixed with coconut oil and mint, it makes an excellent base for homemade toothpaste, effective against mouth acidity, plaque, and bad breath. But in the end, the rule is simple. Bicarbonate is powerful, and like any powerful resource, it demands respect. If used at the right time, it can support your body. If used without discretion, it can become an obstacle disguised as a solution.
If you've made it this far, it means you're ready for more. And the next video is already waiting, packed with practical tips, powerful insights, and real solutions. Click now and keep going on this journey with me.